You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. I am delighted to be joined today by Dr. Sunjya Schweig, integrative medical doctor and founder and president of the California Center for Functional Medicine. Dr. Schweig is an expert in complex chronic illnesses which require rigorous investigation and management. He's been studying, teaching, and practicing integrative and functional medicine for more than 25 years. He offers patients a deep investigative approach to healthcare that's both personalized, collaborative, and data-driven. He's also the founder of a nonprofit called the Functional Medicine Research and Technology Center, where they provide programs and research into several key areas, including first responders, tick-borne illnesses, long COVID, and data visualization. I love that you're providing wellness programs for firefighters who face so much stress and trauma and so many mental and physical illnesses as a result. So welcome, Dr. Schweig. It's a pleasure to have you, and I hope it's okay if I call you Sunjya.
Absolutely. Yes. Thanks so much. It's a pleasure to be here and just really grateful for the opportunity to try to get the word out about autoimmune disease to your audience.
This is a huge topic. I'm obviously passionate about it. And so because this is right up your alley, I know we're going to have a very fruitful discussion. And I always like to start with story. So if you would be kind enough to step back in time a little bit, what caused you to go into the arena of integrative and functional medicine as a conventionally trained medical doctor?
Yeah. My story actually starts, back in my childhood. And my parents were early adopters of vegetarian lifestyle and yoga and mindfulness meditation. I grew up in Northern California and also spent 6 years of my life in India as a kid. And so I was exposed to homeopathy and Ayurveda. And so then as I, got into was in high school and then went to college at UC Berkeley, I knew and I understood, this calling to go into medicine, but I also knew that there are many, many other options out there for how people take care of their health, how they take care of their bodies, how they understand health and disease in the context of culture. And so when I was at UC Berkeley, I studied medical anthropology and religious studies, and then did work in Ecuador with a medical exchange program after college. And I knew that I wanted to become a doctor. I knew that I wanted to go down the MD path. I love science. I think it's incredible, but it's also very limited. And so every opportunity, it does an amazing job on the acute setting, as we know, but really like with chronic disease, with autoimmune, with chronic infections, these functional illnesses of which our society is increasingly burdened, it falls apart, right? And so every opportunity that I got, whether it was an elective or a project where I could do an extra research paper or presentation, I would always focus that on integrative medicine, on functional medicine, and found my way up through my education that way. Went to medical school at UC Irvine and served on their board for the Complementary Alternative Medicine Center and built classes for students and did research. And so it's just kind of been a calling that has carried me through all the way through my training.
Wonderful. And at what point, because I know you've got a little bit of a personal story here, at least a family member, when did that come into the forefront?
Yeah. So my wife, before we were married, my wife and I, we lived in upstate New York. She did her graduate degree at Cornell University, and she was in natural resources studying ethnobotany, medicinal plants, and we were out in the forest all the time. And she got sick during that time with a mystery illness. And, we went to a bunch of doctors. She went to a cardiologist. She was having night sweats and anxiety and heart racing, heart palpitation and fatigue and and these really intense, just out of the blue physical symptoms that nobody could diagnose and nobody really figured out. And it was actually 10 years later,
Mm.
when she became acutely ill with what looked a lot like a tick-borne infection, like Lyme disease. And we did some testing at that point, and sure enough, she had Lyme. She had a co-infection called Babesia as well. And this was after actually a second tick bite. We never knew about the first tick bite. These ticks can be very insidious, but this was after a second bite up in Mendocino, now back in California, that it kind of tipped things over for her. And testing showed these infections, and she was treated fortunately successfully. It took a while. It took about a year of treatment, but really forced us to go. It was actually just had finished my medical residency at the UCSF Santa Rosa Family Practice Program, was just starting in private practice in functional medicine, and was thinking, this is going to be great. I'm going to do a lot of prevention and health maintenance and really help people, avoid drugs and avoid antibiotics. And then we got pushed down this really intense chronic infection path, and that really kind of informed my work very, very deeply. Again, we're very grateful that she recovered her health, and but after that time, I think I really kind of carved out a niche of dealing and finding and treating infections as root cause of illness, which for our topic today is super important. Because many people think actually that autoimmune disease is, something infection related until proven otherwise. We are these really beautifully, amazingly nuanced, complex organisms that have all these other organisms in and on us, right? And that we live in balance with, but things can go awry, as we will talk.
Yeah. Yes, I'm so glad that your wife is better and that she found her path. And it sounds like you kind of found your calling as a functional medicine expert with, well, I should say practitioner with an expertise developing in Lyme as part of what you do, having been through it. So I understand that. And that's a beautiful, it's a story you don't wish on anyone. But here we are, having come through these complex chronic illnesses ourselves or our family members. And we use those stories to help other people. And I think that's beautiful.
Yeah,
So
thank yeah, and then with our, informing our clinic and our team, like when you do that more intensive work, like Lyme disease and co-infections, and I would put mold in that category, heavy metals, et cetera, you really have to people are very sick a lot of times, and you have to really do every piece of the puzzle in order to get them better. So it's like a symphony at work, and so from there, we also see a lot of general patients just with general autoimmunity or fatigue or hormone balancing needs, or other toxins, et cetera. And because it's easy to kind of extrapolate from this, the more complex path, towards these more unique individual kind of focus areas. And I just feel very grateful because we've managed to build a really amazing team at our clinic all of
yeah,
whom are really passionate about helping people recover their health.
I think it's beautiful because you have a bigger toolkit, having gone through the experience, and now, you are awakened to this essential idea that you have to look at all of these factors. You can't just be a clinic that thinks that everything is mold or everything is Lyme, but you have to see the individual as an N of one, but then be curious enough and know the right testing or perhaps a pattern recognition to say this looks like, and maybe we should go in this direction. So that takes a lot of, I think, a combination of humility as well as this developed expertise over time. So
I love
love
that.
that.
Yeah, and I would challenge the listeners out there that just be careful because every practitioner ends up usually specializing in one or two things, and that's kind of like where they focus. And it's kind of like if they have a hammer, everything becomes a nail. And so this, your book talks about this, but like you really want to take a broad look and you want to think about all of the different pieces that are influencing this complex web of interactions. And
Yeah.
just be open-minded. Like you might not think that something is partly a driver, but it certainly could be, and it might be the hidden link to getting you better. So,
Well, this is a really interesting segue into the next question that I have, which is really around looking at autoimmunity from your perspective at a high level. I know you've been a practicing physician for a very long time. You may have seen some patients in your clinic when you were in family practice or whatever come in with autoimmune disorders. And I'm wondering what the landscape looks like to you today. What are you seeing in terms of, maybe the most common autoimmune disorders and if you'd like to paint a distinction between, you present with symptoms, and if you go to a regular doctor, a conventional doctor, they might take a look at it this way versus the lens of how functional medicine looks at something. So I have a couple questions packed in there, but I just wanted to step back and look at autoimmunity more broadly in that sense.
Mm, yeah, very interesting. Yeah, we see a really wide range of autoimmune conditions, and as I'm sure you do, and I think for sure the most common is going to be Hashimoto's thyroiditis, right? And this is, I think the most common autoimmune disease in our society. It affects an estimated 14. So it's a wide range, but anywhere between 14 to 35 million Americans, depending on who you look at. We also see a lot of patients with rheumatoid arthritis, with psoriasis, with celiac disease, inflammatory bowel disease, Crohn's and colitis, et cetera. And then things like now I'm kind of going down the list of prevalence, but pernicious anemia or Graves' disease or lupus or MS, which is where you started your journey, I understand. And so there's probably at least 80 different autoimmune diseases that have been identified. And some can be, more mild and smoldering, and some can be extremely severe and even life-threatening, right? And so what we also know is that, it's very clear that autoimmune diseases are on the rise, that more people are becoming diagnosed, more people are becoming sick with autoimmune diseases. And then we know very, very clearly also that if you have one autoimmune disease that you don't address by, finding the root cause and reversing, that your risk of then having a second or a third autoimmune disease during your lifetime is much, much higher. Right. It's almost like, you kind of open the door to this immune dysregulation and immune confusion and inflammation, which then, predisposes you to the next one. Right. Um, NIH says that there's probably like 23.5 million people in America, about 7% of the population, who have an autoimmune disease. But a lot of advocacy groups, think that that might be very low in terms of a number. That might be as many as 50 million people. Right.
Yeah.
So very, very common, more cases year by year, and for a lot of different reasons. Stress, disconnection from our evolutionary history. Not getting natural light exposure, not being out in the sun much, eating what we call frankenfoods. Really crummy, fake information nutritionally that you're getting. Not getting enough sleep, being on our screens, having our brains be disrupted by technology and by even electromagnetic frequencies and et cetera. There's many, many different factors, that I think lead, obviously, gut issues, frequent antibiotic use. There's so many factors, that we could go through. But really, to answer the second question, I think all people who are in your audience are we're kind of preaching to the choir, I imagine. I hope that there's also some new people that are having their eyes and ears opened up today. Um, but the core difference between what you do and what we do and what functional medicine does compared to a hospital-based or allopathic-based medical system, so called insurance medicine, um, you know, is that we're doing our best to look at all paths, all triggers, all antecedents, everything that's happened to you from when you're in your mom's belly and even before, right? Thinking about epigenetics and ancestral, imprinting, et cetera. All that counts. It's all part of your story, right? And it's all part of what your body's responding to, when you're born, and then, adverse childhood events, stress and trauma early on, environmental exposures, microbiome shifting, inflammatory exposures. It all feeds into, you know, things that we think contribute to illness in general, but autoimmune illness specifically. And then we try to unwind all those. So we test things, we address things, we listen carefully to the story, we create this really comprehensive plans, and then give people the support that they need to be successful. And then contrasting that with the more insurance based or Western medicine or allopathic approach. You know, I think most doctors are amazing, smart, kind, service oriented people. They're doing this because they want to help people get better. And it's not so much an individual provider problem. It's just that the system of medicine is broken and is
Yeah.
not set up to understand or help people with more complex chronic illness. And that's why we're seeing this huge wave of chronic illness, which is going to probably, it is already, but is going to increasingly be um, really detrimental for the healthcare system, if not
Yeah.
dangerous for the healthcare system, fatal. Um, but they're just not set up for complexity. It's siloed, everyone's separate. They only want to deal with one little problem. And almost all the time, the tools that doctors have are, a drug to turn something off, a drug to turn something down, whether it's inflammation or immune system or your blood sugar or, lower your cholesterol, lower your blood pressure, et cetera. So drugs, which are one pathway, or a surgery, or a procedure, or an imaging study, or physical therapy, and that's kind of it. That's kind of it on the toolkit, right? So
Hmm.
they're just not set up. They're not given the tools to really fix this problem.
Yeah. Thank you. I think there's a time and place for acute care, certainly.
For sure.
You're having a heart attack, you have a broken bone, you need surgery. There's probably no place better than to be in one of those medical institutions, right?
Science is incredible. It's
It
amazing.
is. It is. It
Yeah, so
is.
elegant and beautiful.
Yeah.
But we need all of this. We need all of
Yeah.
it to really help people.
It's just a mismatch because so many people are struggling and they would love to be able to go have their primary care provider be able to help them and use insurance to solve the problem. And we're not quite there yet with this being insurance based because it's not in that conventional medical arena, but hopefully with time and
Agreed.
attention and advocacy that will be changing over time. And sometimes I understand it takes more than 20 years for science to trickle into clinical practice. And by my watch, we're a few years past due in terms of epigenetics and things going into medical practice. There just aren't the right incentives in place. So I just wanted people to have that level set because, what you do is addressing the question, why? Why are people sick? And then the other thing that I wanted to point out is that you believe that people can be completely well. This is not autoimmune management we're talking about. This is complete autoimmune reversal. I just want you to, either disagree or let me know how you feel about that because it is such a hopeful thing when people get completely better.
Absolutely. Absolutely. 100%. It's nuanced still, right? Like, I don't want to have everybody out there watching this and just be, convinced that, um, it's going to be quick or easy or even in every case possible to fully reverse the condition because a lot of people have a lot of time that's passed. It's been, decades and decades and decades and things.
Yes.
But in many cases, yes, people can completely reverse and get fully well. And if anything, another silver lining of doing this complex work is that, yeah, it takes work. It takes resources of time and energy and unfortunately money. Um, you know, but it's almost like a shamanic journey, right? And so it's like a lot of times people get to the other side and their health is great, but they're overall better than they started, right? Because of all the things that they had to pay attention to, all the work they had to do, and they're now set up for what I think is, a life of greater health and health span and longevity. So,
Yeah.
that's my dream for people. But it does take a lot of work. It takes a lot of time and energy. So
I love it. I love it. And I would put myself into that
I
category.
know you're
I'm
right.
better, fitter, stronger, the whole thing than I was in my 30s. And it's possible. So I
But you
love that you
made
said,
it work, right? I mean, you
right, right. And so expectations are really important to set them and manage them well. That I say, there's no guarantees that people can completely recover, but greater levels of freedom are available depending upon many factors. So earlier that someone addresses these autoimmune disorders before so much tissue damage has set in, the better. So this is where reaching out to somebody like you is super important as early as possible in their journey. So I'm so glad we kind of went down this side path, but I want to delve right in because you have people that come to you and they're looking to be well, and there are some expectations, or let's call them foundations, for healing that you think are table stakes in the equation. So I'm wondering, what are those things that people can get started doing even before they come see someone like you?
Yeah, so a huge part so we one of the things that I'm really proud of that we built at our clinic is that we do an incredibly deep dive in terms of testing, and also in terms of symptom analysis. Like we ask people a lot of information. So it's kind of a pain in the butt, honestly. They have to fill out a lot of forms and they have to, check a lot of boxes on symptoms, and we ask them to track those over time, and those really help us to understand what's happening. Um, but then we do a lot of the testing that we'll go through. However, even before we have a lot of those results back, we are recommending and supporting people with our health coach and nutritionist to really implement core lifestyle changes. And we like to do this right at the outset, and so the biggest ones are going to be nutrition. So doing an anti-inflammatory reset diet, or even an autoimmune reset diet, is going to be um, stress management. And I think stress, gets a bad word because it gets a bad name because there's a reason for stress, right? So even broader than stress, side note, I love the work of Kelly McGonigal and Isla
Mm.
Crum, and like these sort of the upside of stress, or like how resilience and mindset can really help us manage stress. But you know, but thinking about like all the water under the bridge has happened to us in our lives, and where there are traumas, and there's this thing called the ACE score, which you talk a lot about, the adverse childhood events score, and then how does that affect our hormones and our cortisol and our inflammatory pathways and our immune function and predisposition to autoimmunity. One of my favorite books, like really water damaged and beat up 'cause I had it and have read it, so many times, but When the Body
Mm.
Says No by Gabor Mate, really amazing book. Um, so so diet, nutrition, stress, and what we call neuroplasticity or brain retraining. Getting you can sign up for these programs. You can sign up for Gupta program or Alex Howard or Primal Trust or DNRS, or Amy Apigian, just to rattle off a few. EFT and tapping with Amy Scher. Really core, amazing tools that help to heal from old trauma, and repattern the brain, and then also deal with new stressors and just help you reset. We're never not going to experience stress, but it's a game really of how quickly can you experience that wave of activation and then bring yourself back down the other side and get a reset, right? So nutrition, stress, sleep, absolutely critical. Unbelievable the amount of different directions that sleep helps for immune and inflammation and hormones and metabolic and blood sugar and mood and brain chemistry, you name it. I did a deep dive with my friend Drew Perwitt on a podcast for a couple of hours if people want to listen to that. Mark Matthew Walker, really also a great book on why we sleep. Really important seminal work. Movement and exercise really, really critical to the capacity that somebody can without injuring them or without overdoing it. The whole concern around more intensive chronic illnesses and pacing, and you have to be careful of that. So all these factors, and these are things you can do yourself. And so we have a version of our anti-inflammatory nutrition reset up on our website that people can download for free in the resources section. But yeah, you can get started on this yourself. And but one thing we do recognize is that doing a lot of these health behavior changes is hard, and I think that's where practitioners really can help is not just explaining what to do and how to do it, but like understanding we built in support, right? So like people need making health behavior change and doing it reliably is hard. It's hard to stick to, right? It's just it takes a lot of effort and follow through, and so getting people the support that they need to do that, I think, is really critical.
I'm so glad that you're talking about all of this early on in our conversation, especially the nervous system support and brain retraining, because I think my sense is that people often feel like this is an added thing, another thing that they have to do. And they may not understand the importance of how important something like this is as an essential part of healing, because maybe I know, like me, having grown up with a lot of early trauma, our whole being is in this fight, flight, or freeze mode, or a functional freeze mode. And we can be highly functioning individuals and still have these imprints of trauma or emotional pain that we're not even aware of on a conscious level, but they may be running the show. So, and it's often something that sometimes people aren't willing to look at until they're feeling better, which I understand, right? But I think front loading our conversation with this is such an important element because it's not an extra thing to do. It's a foundational part of healing from my perspective.
Totally agree. Totally agree. And to put it another way, like maybe even to incentivize people more, if you do these things, if you really dial in the nutrition piece and you really dial in the sleep piece and you really dial in the brain retraining neuroplasticity piece, I would put those as top three. Your ROI, your return on investment will be such that everything else you do later will work better. It will work faster. And when it does work, your risk of having a relapse is much lower. Just
Beautifully said.
straight up, because, and there's like, just, we could talk for hours about why that is, but there are so many pathways, right? There's so many pathways in the gut, in the brain that keep the inflammation going, that keep the immune system confused. Hidden infections, they love an environment of inflammation and immune confusion. That's their happy place. So whatever you do from the nutrition side, from the sleep side, from the brain side to heal those pathways, decrease permeability across all different compartments, get the vagus nerve working better, get the brain pathways working better. I mean, it helps everything else, right? It's a web. It's a big cobweb, and you pull over here and it wiggles over here, and so everything's connecting.
So beautiful. I'm thinking of this big, giant network effect of all of these things. So thank you for sharing that, which leads us directly into the next piece because your patient who's come to see you may have already checked in with the health coach and the nutritionist. Let's say they've been doing these foundational components, and then they are ready to come see you. And what's the next step? Like, how do you take somebody through the journey from that point forward?
Yeah. So in our practice, over the you know 20 years that I've been doing this, and the last 10 years that we've had that I've been running the California Center for Functional Medicine since we founded it in 2014. We've really developed a system, and we have a membership, and so we kind of create the first year where it's a very structured program for people. And the on the outset of that is what we call our deep dive onboarding, which is a series of almost 7 different visits usually that happen usually over the first 3 to 4 months of the person signing up. And that includes ordering labs and then doing what we call our initial consult, which is a 60 to 75-minute appointment of just gathering data and interpreting some of those initial labs, ordering the next set of labs, which usually is, the gut testing and SIBO, small intestinal bacterial overgrowth, and maybe mold testing and testing for chronic infections, whatever's applicable for that unique person's case. And then they work in between those visits with our health coach and nutritionist, getting a lot of lifestyle pieces in place. And then they see us again for the follow-up, what we call our case review, where we pull in all that data. And it's a lot. It's a lot of data. So it can be a little overwhelming for people. But while I do think people can be overwhelmed, a lot of times we just get, and this is like probably one of my absolute favorite parts of this work is just this sense of like gratitude and excitement. And so it's like paradoxically, like I can tell someone they have like 7 or 8 things, quote unquote, wrong with them that they didn't know about. And on the one hand, I would think, wow, that's going to be really overwhelming and scary. But most of the time, people are like, this is awesome. Like, I didn't know any of these things were there. Any one of these things could be a reason why I'm sick. And
Yes.
just like the relief of getting the data, but also understanding that there are other options. There's other directions. There's other, diagnosis methods, testing, and there's, a space where we believe in them, that we understand, we believe, and they're not crazy. there's like all this stuff going on. And even after I tell somebody you have this gut infection, you have SIBO, and your adrenals are off, and you have some heavy metals, and you have some mold, and be like, you mean I'm not crazy, right? I'm like, you're not crazy. Like you,
Yeah.
a lot of things going on, and any of these could be the reason why you're sick.
Yeah. It's a relief.
Really,
It's a relief. It is, I'm not
not easy.
crazy.
Yeah,
There are causes for illness. And if you are still sick, you just either haven't found your root causes yet, or maybe you haven't been on a good treatment protocol long enough, or maybe you're not doing things in the right order. But boy, it's such a hopeful time that, understanding what's really going on. I love that. And so I want to go into the topic of infections because you
yeah,
can't really talk about autoimmunity without talking about infections. And the infection connection is huge. So any direction that you'd like to go in, I'd love for you to touch on why it's so important to address infections. What are you seeing when you're treating people? Like what's coming up maybe again and again? I know everybody's different, so they have some different combination of factors. And then let's get into the treatment of those things.
absolutely. Yeah. Yeah, I mean, it's extremely important for all patients, but especially those with autoimmune illness, to understand that, in my opinion, as I said, I think I mentioned it before, but a lot of autoimmune illnesses are some kind of a hidden infection or a microbial imbalance until proven otherwise. And you and I were bonding over this book, Infections and Autoimmunity. It's a huge textbook. I think this thing cost me like $230 or something. But really, really deep dive on so many different bugs, and there's like literature searches on the connections. Probably needs to be updated because this book's a little older. So I might spend some time doing deep research on this with AI and seeing what's happened in the last 5 to 10 years. But you know, we are a collection of microorganisms. We have more bacteria, fungus, viruses, etc., in us and on us than we do human cells, by at least a factor of 10 to 1. A lot of people say, and if you look at the genetic material that represents, it's probably we're outnumbered by a factor of 100 to 1.
Mm,
So as Justin Sonnenberg at Stanford says, we're basically just elaborate transport mechanisms for other bugs. But a lot of these are critical for our survival, and we rely on them to be alive and to function. But when things go wrong, or when we get a more pathogenic infection, or we get a bug that we shouldn't have, again, a lot of inflammation, a lot of immune disruption, and then the path to autoimmunity is really opened up. And we do, again, deep dives on the gut. We do stool testing with a couple of different labs. We look that's mostly looking at the large intestine compartment. We do small intestinal bacterial overgrowth, or SIBO testing, which is a critical part of microbial imbalance and can cause a lot of intestinal permeability or leaky gut, which is really, really critical. You've talked about that a ton in your book and on your podcast. We can go into that in depth if we need to, but super, super key topic. And then we test for, viruses. We test for Epstein-Barr, and do a really deep dive, looking not just at the antibodies, but at the early antigen, and even at a PCR for Epstein-Barr virus genetic material, which we have found when the others are negative, right? So we just kind of keep digging. So Epstein-Barr, herpes 6 virus, cytomegalovirus, Coxsackie virus, parvovirus, the list goes on, and all these can trigger, inflammation, autoimmune activation, et cetera. Atypical bacteria like mycoplasma and chlamydia pneumoniae, very, very critical. And so, Yersinia, even TB, tuberculosis. And, so in the patients who we think need it, we run these really comprehensive panels, and we can run those through Quest and LabCorp, through insurance, if people have that. And then the sort of next step from that, the thing I always tell people though is that it's not always easy to find the bugs on testing. The tests are more designed for acute, like strep throat is easy to test for, right? Some
mhm,
of these bacteria, which can get in and hide out and persist, can be a little bit harder to find, especially like Lyme disease and co-infections and tick-borne infections. So we test, but I frequently tell people that on the test result, a yes is usually a yes, and a no is a maybe. And so if you get a negative test, it doesn't always rule things out. And so we have to really guide by symptoms, and then beyond those first rounds of testing, there's a lot of specialty labs that look at a lot of these bugs, which we will engage with as necessary.
Yeah. Thank you for that. And I wondered, we do a lot of testing as well, based on pattern recognition. I mean, it's not, we don't just assume somebody has SIBO necessarily, but if they're presenting with the things that, are common with SIBO, we might do something about that, of course. I'm wondering if you have preferred, you mentioned you do a few different gut stool tests. Can you share which ones you prefer? Because I know sometimes, they change and new ones come on the horizon, and I wonder what you prefer.
Yeah, we've tinkered with this. We've done a lot of work over the years with split sample testing, sending the same test to the same lab or the same test to different labs and seeing what shows up. It can be a little frustrating at times, especially on the stool, because there's just a lot of variation on what people shed and how and when they shed it. But we do our most common path for stool testing right now is to do the Genova GIFX test, which gives us a really nice look at digestion absorption markers, microbiome balance, dysbiosis, inflammation markers on the gut, fecal calprotectin, eosinophil protein X, et cetera. And then also reports, infections like parasites and bacteria that are pathogenic and yeast and fungal organisms. However, I will tell you that it doesn't find the bugs very well. And
Yeah.
so then I really do like to simultaneously run a second test with a laboratory called Parawellness.
Mm,
Wellness is actually a really cool test. People can actually order that themselves if you
yes.
go to Parawellness and just buy that test and order it. Um, and it's a little bit the opposite of the Genova test, meaning the report you get is very stripped down. It's just like a couple of lines like, yeah, you have these bugs or no bugs found. That's it, the report. And there's no other markers, but it does a really, really good job of finding bugs. And so we find a lot of bugs on that. We find Giardia, we find Cryptosporidium, we find Entamoeba, we find a lot of yeast on that test, which I'm increasingly believing that when you find a high yeast load in the gut, that it's frequently just like a tip of the iceberg to a larger mold problem that people have. And so we get more aggressive then about environmental testing, et cetera. So we do those, and then we almost always do a SIBO test on everybody. And, unless they really have no gut symptoms, but just, if you look at the SIBO literature, if someone has joint pain and inflammation or fatigue and brain fog or headaches, or their cognitive function has been declining, SIBO has a lot of extra intestinal manifestations that, and again, because of it's such a clear driver of intestinal permeability, then we are pretty aggressive about testing that. From there, we sometimes do food sensitivity testing. I actually kind of have stopped doing that for a while because I feel like food sensitivity testing is just sort of a manifestation of intestinal permeability, and you want to heal that.
Yeah.
But I've kind of gotten back into it for a couple of reasons. Looking at some testing, especially with KBMO lab, which um, does antibodies, but also complement levels, so you can kind of see if the food is causing a fire in a way. But then they also test for intestinal permeability on that test, which is helpful.
Interesting. I don't know KBMO.
Yeah, so they do like they give you the last page is like markers of, of antibodies to zonulin and occludins um,
Great.
and also candida. So it can be pretty cool.
Yeah, I like it. Thank you. Well, you mentioned mold. We can't leave a discussion about healing from autoimmunity without looking at mold. So if you find, is this, I love the para-wellness test. It is definitely stripped down and it's a direct to consumer test. So people have to order it on their own. It comes directly to you, and do that if you suspect yeast and or parasites, because it's fabulous. Is that when you take a look at mold, or when does mold come into your hypothesis about what's going on with someone?
Mold comes in really early now, because we just recognize how pervasive it is and um, how how many symptoms it can cause. If you look at, there's a few different buckets of what I'll just call things that can really mess people up. And, Lyme and tick-borne infections is one bucket, and mold is another one. All these gut pieces that we're talking about is another one. But the symptoms also from mold illness and from tick-borne illness, for example, overlap a lot. And so it's really difficult to understand Is this a Lyme problem? Is this a mold problem? Is it a both problem? Like long COVID, I think a lot of long COVID people had some pre-existing issues, whether it was Lyme and co-infections or gut imbalances or some, some latent autoimmunity or some mold, and then you add this virus, and now boom, the system's off, on fire. But we have actually really increasingly have a low bar to test for mold because we frequently find issues, and we are seeing that protocol as really effective and really helpful. That's always our bar, right? For a while, we weren't sure the test was super accurate, and when say the test, I mean specifically the real-time labs urine mycotoxin test. That's definitely our favorite right now. It's the only one we really run on the urine. We will sometimes run a blood test with a company called MyMyco, which looks at blood antibodies specifically to the mycotoxins, not to the molds, but to the toxins. And so that's an interesting test. You can see what the immune system's doing regards to those mycotoxins. But yeah, we find those mold toxins in people, and then protocols involving detoxification and cellular support with glutathione, alpha lipoic acid, milk thistle, phosphatidylcholine, and then stacking in binders binders like charcoal, clay, and chlorella. We actually have been leaning away from the combo binders more and just doing like these single binders we can kind of titrate the doses that way. I really enjoyed your episode a little while back with Nick Hedberg, who's one of my favorite people. But he talked a lot about the gut and these cavities, these mucous membrane cavities, which are frequently where inflammation and autoimmunity is arises and is driven from. And so mold is really intense trigger on the mucous membranes and all the way through the whole intestinal tract. And those mycotoxins can just loop through what's called enterohepatic recirculation in the liver, gallbladder, gut, and just keep circulating.
Mm.
So getting those detox can be really, really helpful for people.
Yeah.
And beyond that, if we are suspicious of mold, testing the home, testing the environment, testing the car, doing carbon tests, getting the right inspector to come out. Finding mold inspectors is hard.
Yeah.
Yeah, and just to put a pin on it too, like that's one of the hardest things we do is like telling people there might be mold in their house because it's so destabilizing, right?
I know.
All those beautiful books behind you, and the
I
amount
know.
of things that, depending on people's sensitivity, that they have to worry about, quote unquote, getting rid of. It's really scary, and then to be, so we do that judiciously, but it can be a real game changer for people, so we don't shy away from it.
So I have a game changer for inspection that I would like to throw out right now. Have you heard about mold dogs?
Oh yes, 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 yeah.
I am telling you, this, for me, in my opinion, is an unbiased, amazingly efficient and effective way to find mold in your home or your office, wherever you suspect mold. The dog will come in, well-trained dog. Now, you've heard of bomb-sniffing dogs and drug-sniffing dogs. There's a guy in Florida, Bill Whitstein, who trains dogs to sniff mold. We actually had this dog come in last week. Okay, it's about $1,400 for the dog to come in plus travel expenses. There are more and more around the country, so just do a Google search.
There's one in the Bay Area too.
Yes, there is, and this is the one that came down from Marin.
They find something? How'd it go?
Yeah. So this is the conundrum. So I'm on a prevention path, right? I know what MS is. I know how to bring it back, and I'm doing everything that I can to not have it. Well, we want to make sure that our environment is as clean as possible. So before we moved into this home 3 years ago, we did a bunch of we had inspectors come and do tests. I got an 84-page report. It is daunting. It's expensive. We did remediation. This is a wall behind my desk here because the ground comes right up to the wall and there had been a leak. So we took care of proper remediation, did all that, and I thought we were good to go. Wanting to check all the boxes in this prevention pathway, I decided to bring a mold dog out to see if we in fact did get all the mold. And it turns out we didn't. And this dog found hidden mold in the master bedroom and part of the master closet. And it turns out we never would have known there was a mold problem there because it turns out the previous owners used to have a bathroom where the master closet is that extends into the hallway closet and just swapped the bathroom to another area. But there was a leak, apparently, that never got addressed. So had we not had the dog come out, the dog will sit down wherever she smells mold and will actually give off whatever signs get a little more agitated when there's more mold present. So I just want to put this out there. I have no affiliation with any of these services except to say that I think it's one of the most efficient ways. I've done ERMES and you name it, the dust test. Those are wonderful, but they don't pinpoint where the mold is. And this can bypass that really expensive testing. So highly recommend do the research, find a mold dog. Some travel to different states because there aren't so many. So that's my little commercial on, helping to clean your environment because it's one of those do not pass go. We find that it's highly immunosuppressive. If you're living in a moldy environment, you can do all this treatment that you're talking about, Sunja. But if you're still living in a moldy environment, it's really hard to get completely well.
Yeah, it is. It is. It triggers a lot of inflammation, a lot of cytokines, a lot of immune confusion. The extra nuance on top of that is that, and I hope you are able to remediate those areas
Yeah, oh yeah.
easily, and it's not too stressful. Kudos to you for taking the extra steps and finding that because that's going to be really really important. Mold's a big driver of dementia and Alzheimer's and sort of long term health risks. But you can also be in an environment where you are clear and free of mold, but you might have been exposed in the past, and we can actually be colonized with mold, and you can be actually self-exposing. And so, sometimes when we see that, we go through all the steps, make sure the house is clean, and then start treating. And again, these detox, pull the toxins out protocols that I mentioned. But then sometimes we'll actually give prescription antifungals as well to just in case there's any mucous membrane areas that are colonized or have mold, so that we clear that.
Yeah, beautiful. Yeah, you can't really talk about complete healing without looking at these environmental factors. They can bring people down, but I know as you see time and time again, when people follow these protocols, they do, it's not easy. It takes courage to look into some of these things, like traumas from your past, like possible mold in your home. They're expensive. They're things that you don't want to deal with, even oral health, which we don't have time to get into today, but all of it matters
All of it
a
matters.
lot. All of
All
it
that
matters.
matters. And to your point, like for the people out there listening, um, you know, I imagine you do feel overwhelmed, and you will feel overwhelmed, and you probably feel scared and fearful of how to do this and how you can afford it and how you have the energy for it. And but just go one step at a time. Just one step at a time. Take each piece of knowledge, absorb it, do something about it, and find the right people to work with. And step by step by step, I expect that you will be on the right path, and that you will then have more and more resources in front of you to do the next thing. We don't always know. I think overwhelm comes from not knowing how you're going to do it all, but it's also like a stepwise process. You find the information and the help that you need at the right time to help you take that next step. So don't be overwhelmed. Just do things. Just try things and learn and you know do your best. I guess just do your best.
So beautifully said. I'm so glad you said that. It is overwhelming, and that was a beautiful way of framing this, one step at a time. Um, so let's finish with where your passions are out in terms of the future and things that you might be working on. Um, Talk to me about that. Where does AI come into play?
Yeah, technology, AI. So I've been doing this work my whole life, and there's a lot that I think we do really well. And at the same time, there is this kind of unbelievable, you know, transformation happening in healthcare and technology, where I just think that we are going to be able to do what we're doing so much better on so many levels, right? Whether it's testing, whether it's analysis of data, whether it's absorbing and digesting and understanding data, whether it's the workflows for me as a doctor. We're using a ton of AI and technology and gathering data like the Aura Ring or the Whoop. I actually have two wearables on right now. And, um, you know, creating workflows around that and creating optimizations and efficiencies. The opportunities out there for the individual patient are amazing. The individual person, you can use these tools to take everything that we just talked about today and take the transcript and put it into ChatGPT and then ask questions of it and have it summarize things or research different things or understand more about what we just talked about. And You can take your, screenshots of a lab report and put it in and ask questions about it, understand it. And I think it's very democratizing and very empowering for people. Caveat on that is that a lot of these platforms are not HIPAA compliant. So just be careful with what data you upload. But you can just screenshot stuff anonymously and then generate summaries that way. We're using a ton of that. We're really looking at and I've been doing a lot of research on this and even talks at conferences and such. We're looking at how do we reimagine, the clinical care pathways that we have in a way that's better for us as providers and helps us to hopefully deliver this care to more people, but also is better for the individual. And so, yeah, stay tuned on that. Maybe in the future at some point we can dive more deeply on that. But that is an area that I get really, really excited about these days.
I can see that. You just lit up like a Christmas tree. I love it. I love it so much. There are so many positive things coming out about AI, and I think that, yes, if you haven't explored it yet, you should, and this is really exciting. I look forward to having another discussion with you on that. Is there anything that you'd like to share in closing, today?
Yeah, no, in general, just thank you so much. It's been a pleasure to talk with you. I really appreciate your work. It was just an absolute pleasure, meeting you couple months back through our mutual friend, Dr. Cynthia Lee. So thanks, Cynthia. Appreciate the
Thank you, Cynthia.
yeah, and we're the California Center for Functional Medicine. We're available. We're we have a website. We're on social. Happy to help people in any way that is good. And as I mentioned, I just feel very blessed to have an incredible team that works at our clinic. Every single person is just so heart and soul mission driven, so smart. We have nurse practitioners and PA and health coach, nutritionists, and our entire admin team. And so just gratitude to all of them for making this a team effort and for all, we're just here to help as in any way that's necessary. So
So beautiful. I love the collaborative care model. Well, I have so enjoyed talking with you, Sunjya. Thank you for your generosity of time and for sharing your treasures with us today. And I look forward to having another conversation in the future soon.
thanks for having me. It's been a pleasure.
All right. Take care, my friend.
And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.